one round, write TB and write the definition of tuberculosis. You write it very simple definition. TB is an infectious disease caused by the Mycobacterium tuberculosis. It is the formation of tubercles and bacillus in the lung parenchyma. That's all about the tuberculosis. See how to make a mind map and concept map of this disease. In one glance, you could see what are all the disease, what is the pathophysiology, what is the signs and symptoms, what is the incidence rate and everything. If you see the TB, in the introduction, what you can write? 1/3 of the world population is affected by the TB. In that 1/3 of the population, more than 50% of the population, TB affected persons are in India. Some statistics you can put it over here. If this point you remember when during exam time, you can write the synopsis introduction, keyword you can remember this. What about mode of transmission? 85% of the TB are transmitted from the airborne, right or not? The remaining will be extrapulmonary TB are transmitted. Oh, how this mode of transmission? You can just list down. Mode of transmission, you can list down droplet infection, ingestion, inoculation, and transplacental. It's a very, very rare. Transplantation placental is very rare. Droplet is the main thing. If you see, then with this, how it is coming 85% you have told. So what is extrapulmonary? 15%. All these things you can write it under the, put one arrow mark, you can write lymph nodes it's affected, gastrointestinal system, GI system. How GI system TB will be affected? Because some of the people will be drinking the raw milk, which is extracted immediately from the milk. The breast of the cow may have this tuberculosis. So they develop the bovine tuberculosis. From this TB in the stomach or any intestine through the blood vessels, it will go secondarily to the lungs. Understand? Then TB also will affect the bones, joints, intestine, skin, TB spine, CNS. When it is affecting CNS, it is called meningitis, TB uveitis, TB osteomyelitis, and spleen, liver, peritonitis. Also joints, it's called arthritis. TB spine, it's called Pott's disease. So how we have done? TB, introduction, what you can write? Mode of transmission, site of infections, or accordingly it will be pulmonary and extrapulmonary. This is the mode of transmission. What are all the risk factors to develop this disease condition? The risk factors mainly poverty, overcrowded area, malnourished children, alcoholism, smoking, drug addicts, then sometimes immunosuppressant people, transplant people, kidney diseases or any other diseases may very high risk factor to develop this disease, right or not? So this is all developing, like these are the risk factors, how it is entering.